Well, hello there. It's Friday. It's a good time to have another Friday focus. I haven't actually done one in a while, so this is good to get back on and talk about some things. We've been talking a little bit about the shoulder, and I just wanted to encourage you to really take care of your shoulder. It's very easy to injure your shoulder, so that the shoulder pain that most people with strokes get is not because of the stroke itself, but because of the way the shoulder has been handled. And good intentioned people, unfortunately, even health professionals in hospitals and nursing homes or TCUs can be a little hard on the shoulder. You never want to pull on an arm, stroke side, because of the vulnerability in the shoulder area, okay? Very good idea when you're sitting to have your arm up on a pillow. That will support this actual shoulder joint, where oftentimes people will get what's called a subluxation, where you can stick a finger or two between the top of your shoulder and the bone of your arm up here. Okay, so if we can keep that elbow supported, then we can also help take away the strain of that, okay? And then you probably have been encouraged, I'm sure, to do these things, but you want to maintain shoulder range of motion. So really good way to do that is hands together with the stroke thumb on top, okay, because it's so much easier to hold on to the hand that way when the stroke finger thumb is on top, okay? Otherwise it's here, and sometimes it can kind of slip out from the grip of the good hand, okay? So try to come in and get the good thumb between the thumb and the finger on the stroke side. Got your hands together, and you're just going to do some reaching with your elbow straight, reaching overhead. Now your good arm may be doing a lot of the work. That's okay. Just very gently raise up your hands and do a lot of mobility. You can imagine how much mobility you're getting at your shoulder blade, all right? Remember, your shoulder blade sits on the back of your rib cage, and we want to see that it can move in a fluid way. So we want to maintain that range while we're gaining more control of the shoulder. So a nice, good over the head stretch, 5-10 times throughout the day is really good. That will get one movement of the shoulder. The shoulder will kind of rotate or slide down a bit. If we want to get that shoulder to come out, we can do the thing with the hands together, and we can reach forward. All right, we're reaching forward. You can put your hands on a tabletop for sure, and just reach forward together. But as you're doing that, really try not to just do the trunk, because that's the problem. You can substitute with the wrong movement. Make sure that you're getting shoulder forward first before you start bending at the waist or at the back. Okay, best to do it at the hips, actually, when you're going to come forward. But make sure you're getting that good shoulder movement. And we talked about it in another video. I want to make that arm longer without moving the trunk, okay? So reaching overhead, all right? Reaching forward, all right? And if that's kind of hard to do without a tabletop in front of you, a lot of times what I'll do is I'll have people reach with fingers. I've got my hands between my knees, and I'm just going to kind of go down with my nose in between my toes, okay, in between the 2 feet, all right? Going down in the middle, and then choosing the stronger side, hands over the knee, all right? I'm going to get my knee up here. Hands over the knee, whoops, over the knee, all right? But I'm sitting down, and I'm reaching down slowly as far as I feel comfortable. I might be able to get all the way down to my toes, but I might just get over the kneecap or the middle of the shin. When that's okay, we're going to go over to the stroke side, do the same thing. Remember, nose over toes, and we're going to get that forward. I'm really kind of just showing you the shoulders right now because I want you to see how much is happening in the shoulders when you do some of these exercises. It's really good, and I'm sure you've been told this by OTs and PTs throughout your rehab course, but don't give up on that. You want to keep moving your shoulder blade well, all right? If you're finding that when you're walking, your hand is coming in a lot and staying in front of you, kind of like this, that means your shoulder blade's not really moving well. It's kind of just locking in, okay? So we want to keep that movement of your shoulder Once we've done the hands together, of course, you can move into just doing a single hand on the table and whatnot. But I would just encourage you today to look after your shoulder, all right? You're the one that's with it all the time. So if somebody is wanting to help you and starts pulling on this arm, say, just wait. I prefer that you didn't pull on that arm, okay? So you want to make sure you're doing that when you're lying in bed. Make sure you're lying on the shoulder blade, on the bed surface, not sleeping on the side of your shoulder. That's when people say, oh, my shoulder hurts if I lay on that side. But if you get that shoulder blade forward, gently pulling from the shoulder blade, not from the arm, you will notice a comfort, actually, in that position. It will actually be very nice. And making sure that your top leg is up on a pillow as well. That can be a wonderful sleeping position for many people. Just take a pillow on your back, and you're set for a nap, okay? So I hope you have a great weekend. It's good to come to you and just talk to you and encourage you to look after your shoulder today, all right? Any questions, post below, and we'll talk about it, all right? You have a good weekend. Bye for now.